So being in Arizona, it's a little bit chillier up here. So my brain's a little frozen, so I wrote down some notes to make sure I don't miss anything. But I appreciate you guys having me up here. I've been talking to Shane for a little bit, and some of the things that we're experiencing in Arizona, you guys. Oh, gotcha. Sorry about that. Thank you. So there's some things in Arizona that we've been experiencing that I want to make sure that you guys evade. We've had a mask order for months now in Arizona since June. Infections are still on the rise. The things that are being promoted actually don't make sense. And I'll get into a little bit of the studies and things that we've been breaking down in our firm. And hopefully we can start that push to give that extra piece to the puzzle that's being missed right now. So at Premier Risk Management, what we do, we have a motto that says, managing risk, leading people. So when we're managing risk, what we're looking at is we're going into various work environments and we're quantifying what the exposures are. We work with various types of industries. We also work with captive markets in the insurance industry. And we'll go into these companies and mitigate the risk to reduce overhead expenses such as workers' comp and just employee loss. So what we utilize, there's a scientific long-term engineering study or a protocol called the hierarchy of controls. So we'll use medical science. Medical science gives us a great deal of how we're going to attack the problem or the contaminant. But the hierarchy of controls, this is a special system that is tried and true for decades. Various industries use it. We use it for our work. And what that means is we look at the different strategies and prioritization of how we're going to implement strategies to reduce exposure. First thing we try to do is eliminate the exposure. That's not always possible, but in the sense of COVID-19, what we do is we try to keep people at home if they're sick. That's a good elimination protocol. Then we try to substitute the hazard. And in this situation, there isn't a substitution, but one experience I've had is, for example, if you have a degreaser with carcinogens, you can use a fruit acid-based degreaser that will reduce that carcinogen exposure. Then we go into what's called engineering controls. And the engineering controls for this pandemic, one of the great ones in a building is called the HVAC system. And what that does is that mitigates your air. I've been on several webinars of colleagues of mine around the world who have been doing air sampling in contaminated areas with sick patients. And they're having a difficult time finding contagion in the air because the HVAC systems are so efficient, especially in the medical facilities. They'll also use negative pressure rooms for these things, which means that the contaminant, any airborne contaminant, will stay in that room while it's being mitigated through the HVAC system. These controls are far superior than PPE, but the next control is administrative controls, which are policies and procedures. That type of control, we're trying to change behaviors. So you'll see that with social distancing, you'll see that with cleaning procedures, things of that nature that are highly effective. But the least effective control is personal protective equipment. That's your last line of defense. And the disturbing thing that we've been watching since May is that people are using this as a centerpiece for their exposure control plan for this. In Arizona, like I said, we've had a mask mandate for several months now, since June. What I've witnessed firsthand, I'm just an observer of people, but since everybody's turned on the mask mandate, they've reduced their cleaning, their hygiene, and those exposures are continuing because people believe that the mask is stronger than more effective measures. And there's a lack of education that's going on in the public right now from public health officials. And to be quite transparent, they don't always have the skill set in this piece. We're hired by medical professionals to come in and train their people. We conduct respirator fit testing, respirator training, exposure training, blood pathogens, hazard communication, things of that nature. They are doing their best. I believe that. I know a lot of them personally. They're good people. But a lot of them don't understand that extra piece. Some do, and the hubris is taking over. But they do. The medical science is important for us to combat this, but also is risk management. That is the piece of expertise that's being ignored right now. Leading people. So when we talk about leading people, whenever there's a dysfunction in the safety strategy, 95% of that reasoning is from human behavior. So when we get back into proper training, proper protocols, adults that have had training are still 95% of the problem. You're putting PPE on children. How is that going to be handled even if you train kids? But they're not being trained. And now we're leaving children to a higher exposure. One of the things that I brought with me, so when we talk about masks, some of the studies that are being used right now, we're actually dissecting those. So the studies are contaminated with other controls being used. They'll reference it, but they don't acknowledge it in the studies. So at the same time they're doing a mask mandate, they're also enhancing their cleaning procedures. They're enhancing their HVAC system. They're also I mentioned the negative pressure rooms, but with the masks, there is a downside to them, and that's not being discussed. And for my long-term study up until May of this year, improper mask use was a contributing factor to high bacterial pneumonia during the 1918 Spanish flu. There's also a randomized controlled trial in the Vietnamese industry where moisture was a contributing factor to retaining the virus or virus material and infecting nurses. I brought this with me. This is it's a sampling media, so when I go out and conduct air sampling, I use a pump, and I'm bringing in about 2 liters of air per minute for about an 8-hour time span. And in here is a gelatin filter. And a gelatin filter is important because it retains, it's moisture, it has moisture on it that retains the viability of the virus material or germ material that I'm testing for, which is important for it to get back to the lab for it to be analyzed. So imagine wearing a mask all day. Imagine the moisture that builds up from the sweat, from your breathing, and what is that doing? It's becoming a petri dish. So and that is a real risk, and that's being poo-pooed on, and it shouldn't be. That is a significant risk for kids, because to this day, pediatricians around the world will tell you children have a higher risk of seasonal flu than they do of COVID-19. So when you're adding risk to kids wearing a mask of being contaminated to the flu, you're increasing their risk. And that leads me to a point where when we're analyzing risk, you can't be tunnel vision. If you get too focused on one thing, you might be creating another risk. There's always a domino effect for every decision you make. And it's important to have an open mind and be able to analyze that properly and account for those things. So with your city council, I'm not an adversarial component to this. What I want to do is be an educator. I want to assist and help you and them come together and really develop a plan, a strategy, because you can't do nothing. You have to do something. This is a real threat. This is a possibility. There are crowds. There are types of people that do have legitimate exposure issues to this. But there is a methodology of doing it to be surgical about it. You don't have to have a plan that fits all. And what we've designed in our firm is a COVID response plan. It's a macro plan, and that's what I would recommend to them. Have a response plan from a macro perspective, encourage businesses to implement this, customize it to the business that makes sense for their operation, and make sure that you're not enhancing exposures. I hope that this can help move that forward, that you guys don't fall into the same trap that we have in Arizona. Because I saw firsthand, clients had people wearing masks outside doing construction in 115-degree weather. I had clients that had people that were passing out on the job site. I have a client that lost his ability to smell. So there is risk to improper use of masks, and there needs to be proper training, but there also needs to be a legitimate strategy that customizes to the business and use far superior controls than just PPE. PPE is our last line of defense. And I appreciate you guys having me out here. I hope that helps a little bit. And if you have any questions, Shane does have my contact information. I'm willing to teach and coach. And we also have we're willing to meet with senior leadership within the city, and my boss is willing to come up with me and hopefully we can help you guys with that extra piece to the puzzle. Thank you very much.